So I think the most important mistakes that are made by primary care physicians in using the electrocardiogram is allowing the electrocardiogram to dominate their diagnostic management styles. So that the EKG is a helpful tool. It is a tool that should be used to guide the management of patients based on their symptoms and signs. But if you use the EKG over the patient, then you're destined to make an error. The key here is that the EKG will inform what's happening with the patient. It's not that the patient will inform what's happening with the EKG. The idea here is what is the order in which you evaluate people. And first it's the patient, and you use the EKG to inform your understanding there. So the use of EKGs in young athletes to screen for potentially harmful cardiovascular abnormalities prior to the participation in sports is a really hot topic. It's a hot topic because whenever it occurs, it seems to occur out of the blue, and it's always a very emotional event. It commonly makes the local newspaper and makes everybody wonder if their child is at risk, because obviously the job of parents is to worry, and if something happens to another kid that's seemingly healthy, you're going to wonder if it's going to happen to your own. The problem is nobody has any understanding of the frequency of these events. In the state of Massachusetts, for example, where I work, the average number of children who die per year while participating in sports is under 5. If we compared that to the number of people who die in car accidents, children who die in car accidents, that's about 70. So you have to understand the relative numbers before you understand whether or not it's worthwhile to perform a test. In a recent study from the state of Texas looking at 2,100 kids who were screened by an EKG for abnormalities, about 10% of them went on to have second tests. Despite all this, only 12 out of the 2,100 kids were excluded from participating in sports. About 120 to 200 kids were worried for a period of time they may have a significant abnormality for nothing. The other problem is that most of the diseases that kids will die from, hypertrophic cardiomyopathy or long QT syndrome, can occur when the kids are at rest. And so just screening the athletes will actually miss a lot of the abnormalities and events when they're going to occur. I think that the infrequent nature of the event and the low-risk nature of participating in sports makes the routine screening only more likely to find red herrings than real problems.